This conference will now be recorded.
Okay, we are live streaming. You can go ahead.
Thank you. Welcome to the March 8th, 2021 Dietetics Advisory Council. It is 2:02 p.m. and we will be holding this meeting virtually. At this time, we'll be taking attendance. Judy Nagy.
Here.
Susan Finn.
Here.
Ashley Pack.
Here.
David Ryerson.
Here.
Mary John Ludy.
Here.
Carmen Clutter.
Here.
And we're only missing Kathy Shalita. And maybe she'll join us yet. Last week when I sent out the agenda for this week, I also sent you the minutes for the December 2020 meeting. Are there any questions from that? If not, can I get a motion to approve the minutes from the 2020 meeting in December?
I make the motion to approve the minutes. I second.
And then a voice vote for approval.
Aye.
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 The minutes stand approved. I'll now ask Chelsea Wansky, who is the Medical Board's Legislative Director, to provide an update.
Good afternoon, and thank you for the opportunity to provide an update on legislative matters impacting the State Medical Board. Our biggest priorities currently remain the budget, the Interstate Medical Licensure Compact, and we are closely monitoring several other bills, including House Bill 122 regarding telehealth and Senate Bill 155 regarding massage therapy. For the budget, in the governor's proposed budget, the medical board was awarded a 14% increase. We did submit an aggressive package to add staff, particularly in response to the Strauss Working Group report. If the governor's executive proposal remains, we will be able to add 6 new staff members to help with our workload. We will also be able to dedicate resources to the handling of sexual misconduct complaints, and we are pleased that our initial budget request was granted in the executive version. We will continue to advocate for that number as we continue to monitor the bill through the legislative process. Director Luca did provide testimony last month before the House Finance Subcommittee on Health and Human Services. We received a few questions, but it seems like they were content with answers, and things should progress as we expect them to. Senate Bill 6 is the Interstate Medical Licensure Compact. This would require Ohio to join the Interstate Medical Licensure Compact. This language is the same language that we saw in Senate Bill 364 during the last General Assembly. We have been holding conversations with legislators as well as staff at the IMLC regarding the board's position on the legislation. And Marshall Smith, who is the executive director of the IMLC, will provide a presentation before our compliance committee on Wednesday and answer board member questions. House Bill 122 is regarding telehealth. This was introduced on February 16th and would permit specific healthcare professionals to provide telehealth services. The language requires that those telehealth services be provided according to specified conditions and standards, and the language is nearly identical to the language that we saw last GA with House Bill 679. And then finally, we have an interest in Senate Bill 155, which is massage therapy. This is language we saw last GA as well, and would require any individual practicing massage within the state to obtain a license issued by the board. And that concludes the legislative update. I'm happy to answer any questions.
Yeah, so I have a question about the budget increase. How do you expect that to affect our day-to-day activities as dietitians? Like, how would that increase support our profession?
So I mean, that's a good question. My understanding is that the increase was to address staffing concerns. We have, based on the fact that we haven't increased staff levels in quite a few years. And we also need to, consider the workload that we have because of the sexual misconduct investigations. So because of the Strauss Working Group report, we believe that we need to increase staffing levels.
I think also one of the examples that the director uses often when she's out, I don't think we have gotten a new investigator in like 20 years.
Oh, wow.
And I think a lot of what we needed to do with the Strauss look back, going back to 25 years, and re-looking at all the files where, there was some type of accusation or complaint of sexual misconduct. I think that has spread the entire board staff a little bit thin. And so we're hoping to get some more people in there to make sure that we're addressing those as quickly as we need to, and to staff up just to make sure that we have enough staff to handle everything for all 90,000 licensees that we have.
Yeah, that's helpful. Thanks, Chelsea. Thanks, Jill.
Any other questions for Chelsea?
Chelsea, I guess the same question would be, do you see any of these issues, legislative issues, Chelsea, that are important to us that would?
So, yeah, obviously, the telehealth bill impacts dietitians. So dietitians were included in that language. Obviously the budget and telehealth have the biggest impact, but whenever we see a piece of legislation that impacts the board, we try to look at it through the lens of every single license type. So, if there's any potential impact on dietitians, we're making sure that we are trying to, get that out to you guys and make sure you're aware of any changes that might be coming your way.
That's good.
And not only Chelsea look at every bill. Any bill that has any impact on the medical board, we obviously send it through to our attorneys to look at as well. But not only that, she has tracking devices for every single statute that impacts any of you and any of the other licensees. And so she gets alerts on that. So I feel like we've got it set up 3 or 4 ways to try not to miss anything, so we can make sure we get it reviewed and then get anything out to you guys that might impact you.
That's helpful. Thank you. Thanks, Chelsea.
Yep, thank you.
Any other questions? Last month, when I sent out all the documents to you, including the agenda, I also sent you a memo that was going to be presented last month, having to do with OPHP, which is our One Bite program, which allows eligible licensees of the medical board who are impaired due to substance abuse to avoid formal disciplinary action by the board by going into this confidential monitoring and treatment program. And so I sent you a document that was going to be presented last month. And again, this month it's going to be talked about as part of a rule. And so this is the rule now that would update the evaluation and treatment requirements for some of the licensees, including the dietitians. And it would change the requirement of the 72-hour inpatient evaluation costing $3,570 over to an outpatient evaluation. And instead, that would cost $800. And so we're going slow with this and really making sure that we're not cutting this because of cost, but that we're still making sure that we're doing something that's easy for the licensees to do monetarily, but still making sure that they get the same type of evaluation that they would have gotten before. And so this is something that's going to be discussed at the meeting on Wednesday during our policy and rules, but I just wanted to make you aware of that as well. I always try to make you aware of things that are going to go before the board, so if you get a chance to watch it, you can, so you can hear the back and forth and the conversations between the board members. But I also want to remind you that if you don't have time to do it when the board is on, we have a YouTube channel, and you can always go back and watch any part of it and actually fast forward to the stuff that doesn't have anything to do with you and get to the part that does. So I just wanted to remind you of that too, that you always have the opportunity to do that later. Are there any questions around this?
People, do we usually see being evaluated through this program?
Let me see if I have it here. Hang on.
I mean, an ish is fine there. I mean, I know you license 90,000 people, so.
I don't have it here in front of me. Can I find out? And then what I can also do is see if I can find out specifically how many dietitians go through the program or are currently involved.
Yeah, it's got to be very few. We had them come before the board. Those issues come before the board a long time ago, but there were hardly any.
Kay, do you have a pulse on how many, like, how that's affected dietitians in the past?
Well, there was very few, Kay.
Well, we've never referred any. We didn't have a one-bite program, but we have referred people to treatment. When I was the director of the old board of dietetics, there was actually a great increase in the number of people who had to report that they had either DUIs or arrests for overconsumption or things like that. And when we would get those, we would open an investigation and to make sure that there was no evaluation that had been done on them showing that they were chronically impaired. And so we would open cases, but many times they would be shut. We did refer people for treatment. I would say that the average was probably 3 to 4 a year that we would have to follow up on, or that we would put on probation because sometimes we'd get cases with people that had treatment and hadn't concluded it or had legal requirements that weren't completed yet. So it's less than 10. It was usually less than 10, but usually 3 to 4, something like that. But I would really, Jill, if we could, like to see the statistics on all the professions, because I had some other questions about what's being proposed here related to the grouping and things like that. It'd be nice to see like how many physicians versus how many PAs versus mentees, etc.
In the memo that was done last month, and I just don't have it in front of me. Okay. Then also keeping in mind, I think it's very few that actually come through the board and get referred. It's more often that people call the OPHP directly, and we encourage that because we don't want to know. We want them to be able to get treatment without, feeling as though that we're being punitive or anything. We want to get them back on their feet and back out practicing with their livelihood and taking care of their patients. So, but I will definitely get that information for you.
Right. I had some other questions if the committee members don't. Would I be able to ask them, Jill?
Sure.
I'm really happy to see that the board's looking at this because the $3,500 evaluation fee is high compared to dietitians' salaries and things. But are there, because of the ranking, I see that physicians represent the most referred group, and then respiratory therapists, and then massage therapists. I was surprised that both the respiratory therapists and the massage, particularly the respiratory therapists, ended up in cluster B and not cluster A, if they're the second highest group that's referred. Now, maybe it's because they're referred and maybe they're referred for evaluation and not ending up in treatment, but was that considered?
I think the respiratory care, let's see. So cluster A, as you were just talking about, because you're probably reading it the same as I am, anesthesiology assistants, podiatrists, physician assistants, residents. Cluster B is respiratory care professionals, dietitians, radiological assistants, genetic counselors, cosmetic therapists, and massage therapists. So you're in with the dietitians are in the same group as the respiratory care professionals and the massage therapists.
Right. Well, I guess my question is, I'm surprised respiratory therapists are in our group because the paragraph before says that the highest number of referred people were docs, and the second highest group were respiratory therapists. So it surprises me that they were able to get down into that cluster B group. So I just wondered if their access to drugs was less than the physicians and the PAs, et cetera, or, you know, how that assigned.
I think we may have had a concern that some of them, because of the cost of the treatment, were then deciding not to get treatment at all and still retaining their license. And I think that may have been the concern. But I will check on.
I see. And then the other question I had was at the bottom of the first page, the last paragraph notes that the recommendations made is to make the rule change for all licensees in cluster B category to set the standards for outpatient evaluations and treatment. So are they going to also receive outpatient treatment? Are those standards going to be for outpatient treatment as well as outpatient evaluation?
I imagine the treatment would be the same. I think the only thing that changes is the evaluation.
Okay. But if you could double check on that, that would be great. And then the last question I had was in the very last paragraph in the document. It says one situation in which no diagnosis occurs is when a licensee reports a history of legal involvement, such as a DUI on a licensing application or renewal, and they're referred for an evaluation. And then it says in some of these situations, the licensee didn't exhibit symptoms of a substance abuse disorder and legal charges had been resolved more than 12 months previously. I'm hoping when they say such as a DUI, that means a single DUI. Because in my experience, when I was with the Board of Dietetics, it certainly was a flag to us if someone had a history of more than one DUI. And oftentimes those DUIs might be spread out within 3 or 4 or 5 years. And maybe both of them, or, you know, one of them might have been settled more than 12 months before, or both of them may have been. But, you know, repetitions of legal issues related to alcohol more than once, I think, is important. So, you know, to me, it should be a single DUI. So anyway, that was just a concern that I had, and a suggestion that if the rule has been written, that we might make when we have that opportunity. But I thought I'd bring it to your attention that we had a little bit of concern with that.
Okay. Thank you.
Thanks for the opportunity.
Yeah, I will get all those answers and get those back to you.
And has the rule been drafted?
It's being talked about tomorrow or Wednesday.
Okay.
Yeah.
So there'll be a copy available.
Yeah, it hasn't gone through the process at all, so
right.
Okay. Available, and then maybe that will alleviate some of the concerns when you actually see the language.
Right. Thank you.
Okay. I also emailed to you in preparation for today's council meeting the amended rule 4759-04-04, which relates to continuing education. The medical board had filed those rules along with 4759-408 and 4759-602 with the CSI, which is a part of the rulemaking process. The rules were posted on the board's website and emailed out to the interested parties. And during the comment period, the OAND had given us some comments, and we talked through the comments on the 4759-04-04 with Kay and suggested some changes, and she walked through those with us and indicated that we would be okay going forward with those. So what the OAND asked was that the rule be amended so that the non-registered licensed dietitians' continuing education requirements would be more similar to those of the licensed registered dietitians by adding language requiring non-registered dietitian licensees to use and document the PDP process as adopted by the Commission on Dietetic Registration of self-reflection, planning, based on individual learning needs assessments and competencies and an evaluation of learning outcomes when fulfilling continuing education requirements. So we made changes to those rules to reflect the association's concerns, and the amended rule will be taken to the board on Wednesday for discussion and approval. So thank you, Kay, for working through that with us so we could get to the point so we could move forward with the rule.
Thank you, and we greatly appreciate it. It was a big deal to us, so we're really happy about it.
We were happy to do it. We were happy to be able to sit down with you and talk through it so that we all got on the same page and we could move forward with it. So thank you again.
It'll be nice to be done with these rules, won't it, Jill?
Oh my gosh, some of those just never move, they never go anywhere. So that does make it nice.
Yeah.
Are there any questions regarding this rule?
So I read through it. I don't have any concerns about it. Is the wonky capitalization, is that just a legal thing that, yeah, so Commission on Dietetic Registration and all that stuff can't be capitalized?
Right.
I think it's a format. I just think it's the way it's formatting.
I didn't have it.
The actual language, it should be out to Wednesday as well.
But the names of professional associations, they always only capitalize the first letter in the first word. It's weird.
Yeah, but I read the text and I don't have any concerns with that.
Okay.
I didn't either. It looked smooth.
Well, I'm glad you guys look at it and that you're okay, so I appreciate that. Hey, do you want to go ahead and give your update now?
Yeah, I really don't have much more. Just to let you guys know that the Academy is going to be having their public policy workshop on March 17th. And so we'll be sharing with our members some of our concerns about some of the legislative issues like telehealth. Of course, as we've indicated to the council before about our amendment that we'll be proposing for writing diet orders. We're also watching the telehealth bill, and I actually did provide testimony last week in support of that. Dietitians are included in that bill, and we want to make sure that we stay included. So we did provide testimony. But other than that, I really don't have anything else.
Okay, who else provided the testimony? You, and was there anybody else?
Nobody showed up in person, but there was tons of written testimony submitted. All the associations, the professional associations for all the practitioners, the hospital association, the medical association, and the committee. If you look at the minutes of the committee, they'll list them all because at the end of the testimony, they read them all into the record.
Okay. Thank you.
Mm-hmm. And that's all I have. But one of the things, sometimes at our policy meeting, licensure questions come up, and of course we'll refer them to the medical board. But I'll tell you, it will be really nice this year to be able to tell the members that might ask questions about the medical board and how we're getting along over there, that we're getting along a lot better now, and the communication's been improved so much. So that's going to be a nice thing, Jill.
Oh, thank you, Kay. We appreciate that. Any questions around Kay's update? Chelsea and I watched Kay give her testimony, and she did a great job for you guys.
Thank you.
No surprise.
Kathy Schlito is not here today, but this is her last meeting. She and I wanted to thank her, so I'll do it while we're on here since it's public, to thank her for her time on this council. Some members do have terms that are expiring next month, and we are working with the OAND, and we will get a process going here so that we can get some new members and make sure by the time, I think by May, that's the next time that we have a council meeting. So we'll have new members on here by May, or returning members. Is there anything else anybody wanted to discuss while we're on here today? No?
No.
Okay, then if not, may I get a motion to adjourn?
So move.
And then a second?
I can second.
Thank you. All right, then this meeting is adjourned at 2:26. Thank you guys for your time and expertise on this council.
Can I get a couple of votes in favor?
Oh,
Oh, yeah. We vote.
There we go.
yeah.
This conference is no longer being recorded.
Thank you very much.
Thank you. Bye-bye.
By the
And
time
thank
we
you.
next, it'll be warm and we'll be all outside in the sunshine.
Yay.
Yes, right.
All right, see you.